Hi, good morning, everyone, and thank you for joining us for this webinar on US healthcare and breaking the silos that are impacting on the patient experience, quality, and safety of healthcare delivery and collaboration among the workforce. My name's Sam. I work here in the quality division at IdeaGen, and I'm going to be the moderator for this webinar. So here's a quick breakdown of the agenda for today. And before I sort of hand over to our expert speaker, I'm just going to quickly go over some of the housekeeping items. So at the bottom of the screen, there are multiple engagement tools that you can use. You can customize your viewing platform today and make the session work to sort of suit you. Using the controls, you can minimize or maximize any tabs on your console and resize them to sort of suit your sort of viewing methods. And there's various icons across the bottom of the screen. Reactions, where you can put emoji reactions based on the content. There's a media player where you'll see the video and the speakers talking. There's the Q&A, ask a question section, where you can put questions that we will try and get to at the end of today's session, time permitting, or follow up with afterwards if time runs out. The slides, so you can see the content. There's recommended content, so additional sort of helpful material that we'd recommend you sort of download and browse through that's related to today's session. The speaker bio and the help button if you've got any technical issues or anything that you run into that you might need help with. An on-demand version of the webinar will be available after on the IdeaGen website, so you can rewatch and share with any colleagues that couldn't attend today. So without further ado, I'm going to hand over to our guest speaker, Denise Wiseman. So Denise is the Chief Community Manager and founder of the PX community. Having worked in non-profit and for-profit healthcare, including the last decade within patient experience, Denise brings with her a wealth of knowledge about what can be done to break the silos that are impacting on the outcomes in US healthcare. So I'll hand over to Denise.
Thank you. I appreciate that so much, Sam. I'm just thrilled to be here with you and the audience today. And I'm going to back up because that first slide we're going to hold on for just a moment as I introduce. So good morning, good afternoon, or good evening, whatever time it is for you. I'm so glad you're here with us today. It is 7 a.m. for me, and I'm blessed to live in Washington State with a view of the ocean outside my window. Today, I'm going to talk with you about a topic I feel is of great importance to our efforts to improve healthcare. The issue is the presence of silos within our healthcare system. And when I talk healthcare system, I'm meaning our individual entities as well as the healthcare system across our nations. And as I share today, the focus will sound very much like I'm talking about organizational issues, but I do want you to think about that as extending holistically. Silos can definitely hinder our ability to deliver comprehensive patient-centered care. It can also hinder our ability to improve the overall health delivery system. And though my examples will also today be very healthcare sector focused, for those of you joining today who might be adjacent or outside of the healthcare industry, I invite you to consider how these insights might be relevant and beneficial to your own field of work. And the title of this webinar, Break the Silos to Build the Cures, it purposely means two things. We cannot improve the care we deliver within our hospitals or other healthcare facilities, or transform our ailing healthcare system at large when we're working in silos. We must break or bridge those silos and begin to deeply collaborate. And that's what we'll address today. So I'm going to start with audience participation. So I'm using a tool called Mentimeter, and I'm going to have you answer the question, what does the term silo mean in the workplace? If you have your phones on you, go ahead and scan this QR code. But I'm also going to present a slide. Let me cue that up for you. And on the slide, you'll see that you can join us at menti.com. And when you get there, use the code 89753034. And I'll give just a few moments for people to give some answers here. We've got one response. There we go. We've got 3 responses. All right. Okay. So I'm going to go ahead and close this off, but yes, that's what the one I expected. A place to store grains and crop. Yes, definitely, that is a silo. And the one I intended was a metaphor for isolated and disconnected teams, indeed. So let's go back to the slides here. All right, so let's talk about what silos are. So individual groups who ultimately share an organizational purpose. That's our intent within our organizations. And for example, in healthcare, I would hope that this shared purpose is the treatment and care of the patients that we serve. But for various reasons, they become isolated and not connected, and their efforts are compartmentalized, and information communication activities are restricted to their specific areas. And this degrades efforts to a shared purpose, as each are now really focused on their own internal priorities. That is siloing in the workplace. So why am I talking with you about this today? You identified, you understand what silos are in the workplace. You know what it is. And if you Google search silos plus workplace, you're going to get about 3.5 million returns. It is a well-researched, talked about topic. If we narrow in on silos plus healthcare, you get more than 5 million results. So the topic of silos in the workplace, the topic of silos as influencing healthcare is not new. So why am I talking about it today? So silos lower productivity and increase costs. In healthcare, silos can negatively affect patients and staff, and they can be highly detrimental. So I'm going to offer a few examples here, though I would expect that you have some from your personal experience. The Joint Commission has found that approximately 70% of adverse events are caused by communication errors. Silos cause communication errors. That is the primary cause for these communication problems and 70% of adverse events. When we look at this further, adverse events are associated with approximately 15% of the expenditures and activities within healthcare organizations. 15%, that's a lot of money and time spent on adverse events. These activities include just identifying what's the root cause, what happened here, trying to repair the harm, whatever that might entail, and other actions. Communication errors, remember, are primarily the cause of adverse events, and adverse events are very costly. And Swift shared that roughly 27% of medical malpractice suits are from communication failures, which makes sense. Adverse events would typically end up being medical malpractice, 27%. So that is additional time and energy to communication failures, which often have a shared root cause of silos. And burnout. Burnout is a topic that we're hearing a lot about right now, but it's been in healthcare for quite some time. And burnout has been well researched and shown to worsen patient safety, lowers patient experience, and decreases quality of care. So we're talking about silos today because they cause harm. And though we are well aware of the fact of silos, we experience it, we feel it ourselves, they are still exceptionally prevalent in healthcare. So I'm not going to read these objectives today, but I just want to let you know that fundamentally my goal is to elevate your awareness of what silos are, their prevalence, and their impact, and then to empower you to identify strategies and tools that you can use to help to reduce the impact of silos in your organization and on your work. So we're going to answer another question. This one is, how much do silos impact your efforts at work? And here's the QR code I'm going to queue up if you're joining us in Menti from your desktop. So again, go to menti.com. And in this one, just a sec as I queue this up for you, the code for this one is going to be 4738781. So how much do silos impact your work? I'll give you just a few moments for that. One person says a heavy downpour. I would have to agree with that myself for the last job that I worked in, that we were very siloed. Moderate impact. Nobody's dancing through silos like they're confetti. That's good. Well, no, I guess I wish we were that way, huh? Okay, so it looks like for most people, it's a moderate impact, and that's what I would expect. Thank you for sharing. So let's talk about that. Let's talk about the influence of silos on our organizations. So silos, those that are that there's a barrier in between. And that's typically what we mean when we use that word silos, that we're not cohesive teams that are engaging with each other, but we're barriers. They result in suboptimal resource utilization. So if you think about it, as each of these silos are seeking to obtain their own objectives, they're pulling on shared people resources or money resources. And the people resources I think about most are like our technology teams. We are so dependent on them. And when each of us are lifting up a new initiative that likely has tech involved, we are pulling on a shared resource team that probably doesn't have adequate supplies for us. Silo teams, again, who are narrowed focus on their efforts, will each lift up their own initiative. So they're all trying to work on a process improvement of their own type. And these can create a heavy burden on clinical, ancillary, and support teams as we ask them to change process, behavior, or make other changes. This can reduce their morale, contribute to burnout, or elevate turnover rates. And as one group makes a change to solve for an issue that they're experiencing, the downstream effect often causes other issues. So I don't know where you're joining us from, but in the US, we have a game that's called Whack-A-Mole. So if you go to a game center, you can play this game. And as you're playing Whack-A-Mole, as you whack one down, another mole comes up. And the goal is to keep whacking those down until you get them all. But the problem is you never get them all because they keep coming up because another was whacked down. Well, this is what's happening as we're working individually on our performance improvement. I might solve my issue, but the downstream effect is causing other issues. So we end up constantly playing a game of whack-a-mole instead of looking holistically and collaboratively for solutions that work for all. And siloed efforts, especially when there are many, often result in failed communication or there's too many things being communicated, I can't hear it all. And communication breakdowns result in misunderstandings, delays, and lost information. And thus, we have those adverse events and other issues that can happen in the patient care centers. And animosity can build. So now we start pointing fingers. It's us against them. So silos get strengthened. And silos can stifle collaboration, resulting in missed opportunities to improve and innovate. They reduce collaboration. They may result in organizations being slower to adapt to change, such as new regulations, new technology, or new treatment modalities, because we've built up this resistance to change because of the silos. And then, of course, it can also cause poor decision-making. So when we're not sharing information or we're not sharing perceptions from outside of our silos, we may make incorrect decisions because we do not have all the information needed. And in healthcare, ultimately, silos impact our patients. They can increase medical errors. They can cause misdiagnoses. They can cause delays in diagnosis or treatment. They can result in fragmented care and provide inconsistent or conflicting care messages. Overall, it reduces the experience for our patients. And silos are shown to result in higher operational costs due to inefficiencies and duplications. So we get duplications of tests or treatments or administrative processes. These are costly financially and emotionally in healthcare. And before I go further, I do want to ensure that I'm not talking all doom and gloom on silos. When we're talking silo, as in cohesive work teams that are they are structured teams, that's not necessarily a bad thing. So when you Google search silos plus workplace plus benefit, you do get almost 4 million results. So silos aren't all bad. So here are some of the things that we can talk about here. The primary problem with silos is the barriers in between and the lack of shared purpose. But when we have a shared purpose, then these groups can still be isolated groups, but we're going to bridge them so that they're connected with each other. And so let's explore what some of these benefits of silos can be. So another opportunity for you, here's the QR code, and I'll cue it up on the screen as well in just a moment. All right, So what are the benefits of silos? If you join us again at menti.com, that code is 59163674. In this one, you're going to just put a text response in, and you can put as many as you want. So if you seek to think, what are the benefits of silos or cohesive work teams, you could say in this way. So I'm not seeing anything come in. I'll give you just another second and then move forward. Okay, so I'll switch back. Oops, I just got some in, so I'll just read them out. Not spending loads of time having to share information with dozens of colleagues. Yes. Teams working on specific areas that meet their skill set, not having to wear too many hats. Definitely. And shared meaning. Yes, yes, very good. So let's talk about that further. Let's talk about what can be good about siloed or cohesive work teams. So working within a team can create cultural cohesion. So that's one of those responses said that. It's a feeling of connection, belonging, identity. Those are critical elements to our sense of purpose personally in the workplace. There's also shared expertise and specialization. You're with your peeps. You can feel connected because your interests are similar. There can also be reduced distractions. I saw somebody said that as well, and that's very true. In organizations, especially the larger we get, there can be a lot of distractions. And so when you can reduce those and focus to the task at hand, you can really accomplish what you're seeking to work on. And then within a group, there's that clarity of role and expectations. You know what you're accountable to do. And that's a really critical component. So there's quite a few benefits of cohesive work teams, which silos, we stop using then the word silo because they become cohesive work teams. And while these benefits can contribute positively to an organization's functioning, it's really crucial to strike that balance. We don't want to be completely isolated. We want to be bridged and connected with others. So the goal should be to leverage the benefits of specialized focused teams while implementing strategies that ensure that these teams don't become isolated from the rest of the organization. So we're going to go one more audience participation here. We've got a few more ahead of us, but this time we're going to ask you, what types of silos are there? A few months ago on LinkedIn, somebody asked that question, and it was really interesting to see the results because what most people think of for types of silos really got expanded, which I thought was fantastic. So I'm going to ask you what you think the types of silos are, and I'm queuing it up on the screen here. So if you're joining us from your desktop, go to menti.com, and the code there is 77775776. And let's see what types of silos you're thinking of. And I'll give you just a few minutes while I take a sip of coffee. A few seconds, I should have said. Departmental, yes, that's what most people think of first, yes. Documentation, that's a good one. Yes, seniority and role, most definitely. Information, knowledge, yes. These are great. Generational, yes, yes, excellent. So I'm going to share some of these, but yes, you've added some excellent ideas or thoughts here in regards to what types of silos. And it is really important for us to be aware of the different types of silos, not those that we traditionally think of like departments, but on that broader scale. So I'm going to go through a few. I know you've already identified some of these, so that's excellent. So geographic location is one that some entities don't think about, but the larger your organization is, if you span a large region, you now have geographic locations. So for instance, in the last organization I worked for, we were in Alaska, Washington, and Oregon. And so geographically, we were siloed by distance, but we were also siloed through different political nature of those different states and the cultural environments. So that causes more nuance to that siloing. There's also segments within an organization. So the organization I worked for was a large healthcare system, again, 3 states. So within those states, they were segmented by networks. So we had a network in Alaska because they're smaller, a network in Oregon, and then 2 networks in Washington. So now we had a division of networks with different leadership. We also had 10 hospitals. Each of those hospitals had their own leadership and way of doing things. Within each, they had their own departments. Some of those were direct patient care, some ancillary support systems, and others were operational support, but lots of silos there. And then further, this system had a clinic network as well. So we were hospital versus clinics. So lots of pull on how we should be strategizing our work and pull on resources. So segmentation within an organization is also big. Somebody said hierarchy, and that is true. Hierarchy, especially the multiple layers, can be very detrimental and create silos. In many cases, organizationally, there is the inability to go beyond the layer above you. The reporting structure is tight, and you're not allowed to skip and go to a different layer. And so that creates a difficulty with communication flowing nicely down, as well as with information going from the bottom up. Power dynamics is a big one. This isn't always an actuality, but a perception. Now, in some cases, behaviors and actions can also come with that sense of power over. And this can be from an administrative, a leadership role, or it can be from a positional role. And again, like I said, it can be perception based. So when I entered into healthcare as a registered dietitian, I was scared of all doctors. And at that time, we were still using paper charts. So if a doctor said they wanted the chart, I immediately handed it over, whether I was done with my soap note or not. And so that positional power can be real in regards to how that person exerts power, or it can be perceived. We also, somebody identified roles and disciplines, most definitely. So silos can be formed by role, such as physician versus nurse, direct patient care versus ancillary care teams, frontline teams versus leadership. And the work of one group may greatly differ from another. And when we're divided, we're not understanding the responsibilities among your peers. And so there again becomes this us versus them, this misunderstanding. And it's also really important to note here that one person can be part of multiple silos. So a nurse can be part of the nurse versus physician or other professional groups silo. They can also be their unit versus another. So a med-surg unit nurse versus an ED nurse. And it can also be frontline nursing versus nursing leadership. So those silos can influence in multiple ways. So other silos are efforts, goals, and performance incentives. So whatever we're working on can cause a silo. For example, if I'm in the patient safety team, I am focused on my patient safety efforts, and I might not be recognizing that my efforts are very similar and correlated to the work of a patient experience professional, but we're siloed, we're doing different work rather than seeing our complementary overlap. And so that's an important one to consider as well. Work shifts is likely one. I'm looking over to see, I don't think I saw that listed, but work shifts in like a hospital especially is a big one. So the AM versus PM or graveyard teams, the weekday versus weekend, you get very different cultures in those different segments. And then other items to identify. So I saw that we have Rosanna on with us. So data silos are significant. When we're segmenting our data and not allowing it to commingle in a manner that we can see what the story is telling us holistically, that's a big deal. So having our quality and safety and experience and other clinical data separated, we're not looking at our influences on each other. So again, that whack-a-mole. We're also not looking at where we might have a shared initiative that could cross all of our desired improvements. And then seniority. So when I think about seniority here, I'm not thinking hierarchical. I'm thinking about those who perhaps have been with an organization for decades versus those who have been there for 5 years or less. There's that perceptual difference there in regards to, I've been here longer, we've done that before, the young kid doesn't know anything, etc. So let's do another audience participation. And this time we'll talk about the causes of silos. And I am going to imagine we're going to hear similar to the types of silos, but what causes are there for silos? So there's the QR code, and I'll cue this up on the screen as well. Again, we're at menti.com, and the code is coming in just a moment. The code is 37, as I try to share screen at the same time, 37540147. So when you think of the causes of silos, management decisions, indeed, yes. Poor leadership, lack of training, yes. Competition, indeed. We compete for a number of different reasons. Governance structures, definitely. Lack of clear process, I agree. Good. A competition again, yes. I think competition is a big one. So let's go through these as well. And I'm seeing others come in. I love this. Thank you. So the causes. Organizational structure is one that I saw listed, and indeed how we structure our organizations can be challenging. So what I do want to emphasize here is I don't think anybody goes purposely to create silos and thus the problems associated with them. It's unintended, but that's where developing an awareness of what they are, the harm that they cause, and how they are caused is important. So organizational structure is a big one. This can create lots of different silo formation. We're divided by the type of work effort, so all of nursing versus all of medical, etc. And then hierarchical alignment causes problems. Departments and units are operating independently. Communication tends to report only up through those siloed areas. And then we also unintendedly, perhaps, cause barriers between the different segments, as well as sometimes within our different branch. This can happen often when we've got, for instance, the hospitals versus clinic network. So another structure is the lack of shared goals and alignment to shared purpose. So I think you've heard me say this before. This is going to be a big one. When we aren't focusing on the same purpose and our goals aren't aligned, we cause barriers. So I do want to pause there for a moment and kind of talk about this a little bit further. This could be a webinar topic on its own, but I'm going to give you the abbreviated version here. So when you look at this dashboard, now it's purposely made so you can't really see the details. That's not the intent. The intent is to identify that we have a number of different pieces of work or measurements on this dashboard. And each one is typically associated with a different department. So for instance, human resources, patient safety, quality, nursing, and others may have one or two of these that they're asked to be doing work efforts towards improvement and to report on a monthly, quarterly basis. And this dashboard fits on one page, but I've been part of organizations that have 20 or more different measures they're looking at regularly, and they don't fit on the same page. Each of these is an individual effort. If we're trying to improve something, then we have an effort typically behind that. And each of those efforts are pulling on shared resources. We're not focusing collectively on an effort and a target goal. Those individual priorities can increase barriers between departments. So we're not aligning to one goal. Instead, we are creating stronger barriers between each of the different departments. And now as we're throwing our darts at our targets, we're off. So it's not just that organizationally we're missing our shared purpose, but each of us are missing our targets because the silos have gotten so strong. In the book, The 4 Disciplines of Execution, the authors identify that with 2 to 3 priorities, separate goals, an individual, a team, or an organization is likely to achieve them all with excellence. However, when we move these to 4 to 10 priorities, again, each one of these is distinctly different target. An individual or organization is likely to only achieve 1 or 2 of them with excellence. And when I say excellence here, what I mean is that I'm talking about true implementation, where that implementation is sustained. And so often what we tend to do is what I call introduce. So we have a project, we do a lot of training, we check the box that we implemented when all we really did was introduced change. Implementation would be sustained. We would see the results of our efforts on our dashboard, and we would see when we come back to teams or departments, whoever we've asked to make a change, that those practices are still in place. But I've been parts of too many organizations where we've re-engaged with hourly rounding or other types of initiatives over and over again because we only introduced, we did not implement. And with 10 or more priorities, the authors share, and I've seen this, we are unlikely to achieve any of them with excellence. And in fact, I would say that we're likely to see a lot of corners were cut to be able to check off that I did the training and the work to introduce it, but we did not implement. When everything is a priority, nothing is. You can't get it done. But when we narrow down, we can get things accomplished. And there was a recent example that I think many of us experienced, and that was what happened with COVID. So when we had to shut down a lot of the work that we were doing in healthcare and focus on truly shared purpose with just a few priorities, we accomplished amazing things. An example, the organization I was working with had been working on implementing telehealth for a few years, and they didn't think that they would actually be able to lift it across the full system for another few years. But when COVID happened, we had to, and it was amazing when everybody they weren't focusing on other things. We were focused collectively on just a few priorities. We implemented telehealth in just a few months, and it's sustained beyond COVID and has flourished. So when we narrow our focus, we can achieve a shared purpose. So let's go back to the causes. Organizational culture. Yes, I see culture was listed. That's right. And I heard a couple people say competition. Competition is part of culture. And so when we create a culture that promotes or allows competition, then we create silos. And competition can simply be that we're competing for limited resources. I have a goal I need to obtain, and I need that resource as well as somebody else does. It can also be a competition that is, I want to appear to be better than, I want the recognition, and that can cause the competitive culture. So competition is good, but it can also become very detrimental. The other cultural item would be our hierarchy. So when we have a hierarchical structure that says you can only talk with your one-up leader, you cannot engage with somebody above them, that is a culture that we've created that really stifles engagement and the ability from the bottom up communication. And then, of course, talking about communication, causes of silos can be the poor communication channel. So when we're not sharing information, when we're not helping people to gain awareness of what other work is being done or the roles of other individuals, we can create more siloed departments. And then historical experiences. So I talked about the luggage that can be carried from seniority when they can say, we've already tried that before, or, just wait, this too shall pass. Or this can happen through mergers and acquisitions. So there's luggage that is carried into those newly formed systems when we're adopting new hospitals to join us. They have their ways of doing things, and they want to carry that with them, and we're asking them to drop, and that can cause further siloing. So just a reminder, though, silos aren't all bad. It's the lack of the shared vision and the barriers that cause dysfunction. So let's look at this from the solution standpoint, the breaking of silos. So let's talk about busting or bridging silos. We should bust or break silos when the silo serves no good purpose. For example, hierarchy that prevents the ability for communication to flow well up and down and to engage across. The power dynamics that we've created, those should be busted. And then departments who hold responsibility for results that are the actions of others. And I talk about this often with the work of patient experience. We often have this department of patient experience, everybody turns to just ask, why is experience not shifting? But they don't own the actions of experience. They own the coaching, the understanding of the data, and working with others, collaborating with others. And that should be a busted, in my opinion, silo. We should not have that silo at all. But bridging is where we really want to focus. How do we bridge? Because most of our departments are really good cohesive teams. How do we bridge so that now they're enabled and encouraged to connect and collaborate with other teams? And so that's what we're going to talk about next. So another audience participation. I'm curious what you think about how do we bridge these silos. So there's the QR code. Let me cue it up on the screen. And so if you're joining us, if you've joined late, we're going to menti.com. And I'm going to share the code in just a second. Okay, I think you should see it. It's 14593936. So how do we bridge those silos? And I see shared quality practices. Yes. That we're aligned. Yes. I'm going to take another sip of coffee while you contribute. Yes, a culture of open communication. Indeed. Transparency. Indeed. Okay, I'm going to watch. Those are going to continue to come in, but I'm going to go to, efficient software. Yeah. Okay. I love the answers. I'm going to watch those continue to come in while I go. I'm going to talk about a few, and I'm still seeing more come in. That's awesome. So before I share specifics about how to bridge silos, let's share a few examples of organizations who are successfully doing this. And I found some really great examples to share with you. So Michigan hospitals have adopted the process developed by Johns Hopkins. And this includes following a checklist when placing central line catheters and their focus on a culture of safety. So this culture includes empowering all caregivers, regardless of position, seniority, hierarchy. So this is nurses, physicians, the environmental care teams, etc., that they should stop the process or the procedure and ask questions if they have any concerns about safety. So they are breaking the hierarchy structure. They're breaking the power or the role structure. They're also celebrating when people do this. So when somebody stops and asks questions, it is celebrated regardless of whether or not everything was working well. It's that culture of let's make sure, I'm concerned, I'm curious, that is celebrated within their organization. And this study from 2011 founded that bloodstream, so they're empowering caregivers, and bloodstream infections in these hospital ICUs were virtually eliminated. And across the hospitals, deaths from infections had been reduced by 10%. Significant positive by breaking down silos. Another example is the use of lean methodology at Virginia Mason. And you may know of them. They are well known for the work that they've done here. So they have worked hard to streamline procedures, but when they do so, they're bringing in multidisciplinary teams to work on this. They're also fostering collaboration and greatly seeking the reduction of duplication. And so what they found in their studies is that they have de-siloed across their organization. And they share that managers are reporting working less overtime, feeling more supported. They have more meaningful opportunities to coach staff and foster growth. They also feel that they're receiving more credit for contributing to the organization's larger goals. So that tells me they're aligned to a shared purpose. And one more, Intermountain Health. They focused on developing team-based structures. So rather than nursing reporting up through nursing and physicians and whomever, they're working as collaborative teams in their care. Thus, what they're finding is they have demonstrated improved clinical outcomes and decreased costs. So again, they're seeing all perception as they're working to provide clinical care, and they're seeing the benefits of that. Okay, so let's talk about how do we bridge silos, and this is not going to surprise you. The first is, do we have a shared purpose? So what is that fundamental purpose that we're all targeting, and are our goals aligned around that? Are they directly connected to that shared purpose? And when we're aligned, we're going to hit the target. The culture. Are we fostering a culture of collaboration and open communication? Are we making information visible, that this culture it's transparent, I know what's going on? That we're cross-training. So when I say empathy and understanding here, what I'm meaning is reducing the us-they perception. So we're cross-training or giving people the ability to learn what others do. What is their role? So this could be that they're shadowing somebody or they're just asking questions. Tell me a little bit more about what you do or your department does so that we have a better understanding. Oops. Oh, I wanted to click. There we go. An interdepartmental meeting. So when we have a meeting, are we always meeting just as our department, or are we inviting others to come in, especially if we're talking about something that greatly uses what they're doing? So perhaps it is inviting patient safety in to a unit-based meeting on a clinic unit, so that we're inviting people in and making it so that we're working collectively together on this rather than trying to create our own solutions in isolation. And of course, I added in, let's make sure that we're inclusive of everybody, and we have the tools to do so now. Thank you, pandemic, for making that something that we use all the time now. And then informal gatherings. Now, it doesn't have to be my favorite, which is an adult beverage in hand. It could be that you're going to lunch together. But the intent here is that we stop seeing each other as nurse and physician or other, but instead we're seeing each other as Denise and Sam. And we're able to actually build relationships. When we have relationships, we bust silos. And then cross-functional alignment. Again, similar to what we saw from Intermountain Health, that we're bringing teams together and we work as a functional group. We have a shared effort that we're working on that will bridge silos. And one of my favorites, I love systems thinking. So I don't know if you've heard the analogy of the dance floor versus the balcony, but it is one of my favorites. So let me tell you a little bit about this. If you think about when you're on the dance floor, you're very focused on your partner, whoever that may be. You're focused on the moves that you're making as you move together in your space or as you move around the floor. You might be somewhat perceptually aware of those around you. You might be even talking with some of those individuals, but typically you're just peripherally aware and you're unaware of your influence on them. So you might accidentally bump into a couple and think nothing of it, but that couple, like a ripple effect, bumps into another and another, and somebody on the outskirt of that dance floor could actually bump against the wall or fall down, and you don't even notice. You're unaware. When we go up to the balcony and we look down at the dance floor, we can see the effect. We can see each of the different partners that are dancing around, who they're engaged with and how they're influencing the others on the dance floor. We can see if somebody has started to do a disco move in the center and they're taking a lot of floor resource as they're doing so, and what's it causing the others. And we can help to make that awareness for others to see and bring it back more cohesively. So getting up on the balcony is really important to break silos. And celebrate the efforts towards shared goals, and also celebrate when a department is recognizing the goals or the efforts of another department and are reaching a hand across to say, hey, I can help with that. So anytime there's collaboration, celebrate that and make it public, make it very public so that others know this is what we expect. And you're creating that culture of sharing and collaboration. And then, of course, I saw leaders was listed. Indeed, leaders must role model this. So how are they helping to break down those barriers with hierarchy or across different, the nursing versus physician versus others? How are they doing that so that others see them role model it? And how are they encouraging and helping their teams to do that? All right. So now I'm going to give you 3 things you can do. So Karen Tilstra joined us last year, actually in 2022, it's been a while, and she is known for her work in innovation labs, and she works often in hospitals to help create those innovation labs and bridge silos. And when she was with us, she offered these 3 actions that I'm going to share with you, and they're perfect, they're easy, anybody can do them. And the first one is get up and move. Go see for yourself. And the example she gave, because you might, if you're working in the lab, you may not be able to get out of your lab. However, from where you park to getting to your department, your unit, your office, whatever it may be, you can take a different path through your organization. You can purposely meet others and connect with them, build relationships. So the most important thing is to get out of your office, department, whatever it is, in order to get out of your silo. The next one she said was ask questions. So when you're meeting with people, ask them, what you're doing is interesting. Can you tell me more? We have challenges in our department. I'm wondering what you might be doing, and then connect with them on that. Invite people in to tell you what they're doing. Be very careful that you're not coming across as accusing them. Why are you doing that? But I'm so curious about what you're doing. Can you tell me more? This will help to bridge silos. And then identify touch points. So for most of us, we have a crew or a couple different people or departments that we work with often. We recognize our connection to them, but we may not recognize that, especially in like a hospital, you're only a few degrees away. If you think about the Kevin Bacon, you're only a few degrees away, separated from everybody else. So think about those others who you might be connected to that you hadn't thought about before, and take a moment to really contemplate that. So not just those you interact with always, often, but those you don't interact with but might be influenced by what you're doing, or you're influenced by. When you recognize those touch points, now begin to build relationships with them. And I always caution, be careful in regards to how you start to do that, because they may have recognized how you're affecting them, and there could be some animosity that's built up. So recognizing that you might need to slowly build these relationships, give them some grace and some forgiveness for any frustrations they might express, but recognize your influence beyond what you typically see. Now you're moving from being on the dance floor up into the balcony. So those were the 3 that she shared with us. I'm going to ask you one more question before we close up here. So what will you do to reduce silos that negatively affect you or your organization? So the last QR code, and let me cue this up on the screen. As I do this, I think about our doctors and when they complain about all the clicks. Here we go. So the code, if you're joining us at menti.com, that code is 27295647. This is the most important thing of this. What are you going to do? How do you take what I've shared with you today and make a difference within your organization? I see ask more questions and be proactive in finding best practices. That's perfect. Create cross-departmental work groups. I love that. Reassess our processes. Yes. Speak more to other departments. Yes. Build those relationships across. Good. I hope that you're taking something from this with you that you can proactively use going forward. So coming back to the objectives. So again, with the objectives, my desire was simply to increase your awareness so that you're aware of silos, but beyond departmental silos, what are those other silos and how are they affecting you or your organization? And that you have some tangible ideas for how do we break these down? You can recognize the causes and maybe identify what you can do to resolve these. And that's the end. Now we've got a few moments for some questions. And I do see, Sam, I see some in the tool here. Let me see if I can get there.
There's a couple have come through.
Nice. Okay, so the first one I see in the list says, in a hospital, who should we be involving in the conversation of improving quality and collaboration? Raj, yes, I think the first thing I would do, especially for whatever role it is that you have, is sit down and think about those connection points and really try to think beyond who, from the work I do, who do I know I'm impacting and who else might I be impacting? And then go seek and have conversations with them. Try to bridge that gap. Be careful as you go, again, because they may have some animosity because they've recognized it before you have, but really work to resolve that through building a relationship. And I think that's going to differ for everybody based on the role that they have. I think for leaders, though, one of the best leaders I ever worked with, he was the COO of the hospital. And the first thing he'd do, of course, he'd get to his office, he'd put his stuff down, but then he didn't get coffee from the C-suite offices. He went down to the cafe to get the coffee. And on the way, he always took a different path throughout the organization. And he would stop and talk with people. He was well known. So people knew if I saw Paul coming, this is not a bad thing. He is not looking for what's wrong. He will never mention what's wrong unless there's a crisis happening. But he would want to talk with you and find out how you're doing. And he knew a lot of the names of people. He knew what was going on throughout the organization. And people welcomed him when he would come into his department. That's the type of leadership that we would love to see. I also worked for an organization that had a C-suite that had their own parking garage and access to their special area of the building. And it was a badge door, so only certain people could badge into that C-suite office. And when they came to meetings, it was in their conference rooms and people came to them. They did not go elsewhere. That was very siloed. They were not aware of what was going on. So I think leadership, how they are behaving, will help with this a lot, Raj. Betty asked, how can technology be leveraged to streamline workflow processes and improve coordination of care? That is a really good question. I think that when you talk about technology, one of the things that I would say, so I worked for about 8 years in healthcare technology in the hospital I had started with as a food service director. What we found there is there were a lot of silos actually caused by technology because each different department would want technology that catered to what they're trying to improve, what they're trying to do. And we were not looking organizationally at technology and how it connected and its influence across the entire organization. So I think when you talk about technology, the first thing I would do is make sure we have a really good understanding of what they call the data stack. So what are the technology we're using? What is all of the different data we're collecting? And can we interface that so we can get some meaningful understanding? And then be very thoughtful of what technology we might turn off, get rid of, and others that we might lift up. So Betty, that is not a simple one to answer, but that's a start. How can data be shared and analyzed across departments to identify opportunities for quality improvement and better coordination of care? I love that one. And I know if we could turn the mic on for Rosanna, she would be the one to actually ask this of. She's an expert. But what I would say is the first thing is let's not do a data dump of information because all that does is increase the complexity, the misunderstanding, the confusion over what we're trying to do. So when you're talking about data, I think it needs to be really clear and relevant to whomever you're sharing it with. So the data that you share at a leadership level is going to be different than that you share at the frontline level. But I think accessibility is important, but making access to it is only good if you also have ways to ensure that somebody can see themselves in the data and understand how their actions are influencing it. So again, that's another one that I would say is very careful, but I do believe in transparency, making it available, but let's be careful with how we do that. That's a great question, Betty, and I would recommend Rosanna Galindo for a webinar. She is fabulous. How could the organizational measure the effectiveness of collaborative initiatives and quality improvements? That's a really good one. So one of those, when I was saying celebrate when we're seeing people are collaborating, recognizing that and making it public, I think that's one of the first things that I would say is when we recognize it, when we see it, make it public, and then you're tracking it, right? If I'm recognizing somebody for this collaboration, I can share it. Share the story behind it too. Exactly what did they do and why was that so valuable? But I think first it would be to make it transparent and available for people to see and create that culture of. And then the effectiveness, it depends on what they're collaborating on, but definitely show the pre and post measures perhaps. Here's the problem that we were seeking to solve. We came together and here's what we're seeing now. You could also share, we also made sure we touched base with all of these other stakeholders to ensure that our influence wasn't going to cause a problem for them. I think any of that, when you can make that process transparent, will help to bridge these silos and really enhance the collaboration among your teams. And Sam, I'm looking at that clock. I think I only have a few seconds left.
Yeah, I think it's time to wrap. It's a fascinating subject, Denise, and so we could talk for, I'm sure, another hour quite easily on it. But I think it is time to wrap there. But thank you very much. It's been really insightful and really valuable. So do appreciate getting your insight and your expertise today. And thank you to everybody for joining us. Really appreciate your time. And if you'd like to engage further with the topic, you can check out some of the resources on adiagen.com. But otherwise, thank you again for joining us, and we hope you have a great rest of your day.